Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer DeSablo, your host for today's show. Franklin County Home Health Agency is your local nonprofit home health care and hospice organization that has been caring for people of all ages throughout Franklin County since 1969. Through this show, we bring you information about the services and programs we provide, as well as tips to help you and your loved ones stay safe and healthy at home. April brings more than just May showers. It is also Advanced Care Planning Month. We plan for most things in life. We plan for college and marriage and retirement and childbirth, but we often are reluctant to plan for what will inevitably happen to all of us or for a healthcare crisis. So with me today to talk about our Franklin County Advanced Care Planning Initiative and the importance of advanced directives are two guests from Franklin County Home Health Agency, Mary Harwood, our Community Relations Manager, and Jean Duby, our Hospice Clinical Nurse Manager. So thank you both for being here to talk with me today. So we want to know a little bit about yourselves before we begin. So Mary, if you want to talk about yourself and your role at Franklin County Home Health.
Okay. Community Relations Department, which is Promotion and Development. Jen is part of our department. We provide the information for the public about what our work is, who we take care of, and also do fundraising to support the care that we provide to the people in the community.
Yes, thank you. And Jean, tell me about your role in hospice.
So I'm Jean Duby. I'm the hospice manager at Franklin County Home Health. In that role, I provide a lot of education to our area providers. I partner with a lot of the facilities in the area, along with even UVM Medical Center, to provide care for hospice patients. I go out and make visits, and I help and promote training and education for our staff.
Wonderful. Well, we're so glad to have both of you on board at Home Health. And what we're talking about today is a lot to do with our partnership in the community, like you've mentioned. So we are here to talk about the Franklin County Advanced Planning Initiative. So Mary, if you want to share with us who are the partners in this initiative and give us some background as to how this came about in our community.
Well, it came about in the community because it's sort of an outgrowth of the old, what was called Center for Health and Wellness, which is the partnership between Home Health, the hospital, and NCSS. And we wanted to raise awareness of the importance of having advanced directives for everyone in our community. And so we came together this is our third year, so about 3 years ago, to figure out how we could do it. The first 2 years we concentrated on our staff and had a little healthy competition, we called it, to see who could get the most staff that had an advanced directive. And we won the first year.
Home Health did.
Yes. And last year we tied with the hospital. But we decided this year we wanted to go branch out and go further with our partners and really get into the whole education in the community. And I should mention we've also grown our list of partners, and we want to do some more outreach for next year too, to go even further. But it's Northwestern Medical Center, St. Albans Health and Rehab Center, Northwestern Counseling and Sports Services, the Franklin County Rehab Center, Villa and Holiday House, and the Notch. So we are covering a lot of the healthcare providers in the county, and like I said, we want to reach out to more of our northern partners for next year.
Oh, good. So we should probably put some more information around what the advanced directives are and what this is that you are trying to promote in our community. So these are wonderful places full of staff members who reach out to people every day and families. So it's a good place to start sharing what advanced directives are. So I think we should tell our viewers some more about what an advanced directive is. What is it that we are trying to encourage in our community? So Jean, if you could do sort of that, break it down into the who's your person, what's your plan, explaining what an advanced directive is.
Sure. So an advanced directive is advanced care planning, or planning throughout your life. And it's a revolving plan. It changes as your life changes. And it should start at the age of 18. Mm-hmm. So at the age of 18, you should know who your person is. Mm-hmm. So that's the person that will help guide your care if something should happen. We all know that, we're not, age doesn't matter as far as illness or accident. And there are times when those young folks don't have a person that they've picked to advocate for them if
So
they can't.
Who's your person? So I think a lot of us jump right off and think of our immediate family. Can you give some advice about, or who can be your person, who should be your person? Talk about some ideas there.
Sure. So anyone can be your person. It's important that you pick somebody who knows you well. If it's Aunt Mary 3 times removed and you don't see her for 20 years, that may not be your person. But somebody who knows you and sees you often, knows what your life wishes are, and can make those decisions if you become too ill to be able to do that for yourself.
In a few years ago, we used to call this Start the Conversation because of that idea that you'd want to be conversing with this person or more people in your life to help come to some of these. We can talk about that, how you find your plan. But so knowing somebody you trust, somebody that you've had talks with. If they're your person, do you have to be their person?
No, it doesn't have to be reciprocal at all. But it's just something very important.
Yeah.
Yeah, and we do have the conversation guides that went with the Start the Conversation program, which is what we were calling it for the first 2 years. And they do have some really good resources in them that for instance, here's tests that you take on some scenarios in healthcare, and then you have your prospective agent take it, and then you compare your answers. And they thought you wanted this and you wanted that, and then
Kind of like an old version of the wedding game show.
Right, yeah.
How well do you know me? That's a fun way to I should say fun, but this isn't always a fun topic for people. Bringing up a healthcare crisis, or bringing up what will I do if I'm not able to talk for myself in a serious illness, or at a natural end of life situation. So we, it can be difficult, I'm sure, and we can talk some more about how you have that conversation with people. But how do you define who's your person? Is there something formal you need to do?
No, actually, there is a form. It's in the new Taking Steps pamphlet here, and it basically outlines your name, it's your demographics, and who that person is that you want to make your decisions if you cannot, and a signature. Needs to be witnessed by 2 folks. No one within your family, usually like a clergy member or a social worker sometimes can do that for you. A friend of the family.
So easy to complete, your contact information at the time.
That's right.
Is it set in stone if you choose somebody today and 10 years later, either your relationship's different or you have someone else you want to identify? Can there be more than one?
It can be more than one.
Yeah.
Yes. And it's important to update these forms, as you go on in life.
Yeah.
there's also an interesting question that they ask you: is there anybody that you don't want to be consulted? So if there is somebody in your family that you know you would have a conflict in their beliefs against your beliefs, you can make that.
And a safe place to do that, because you don't need to declare to them that you put their name here as I don't want them to contact me, but
Right,
it gives you some power where you need that.
Yeah.
So you complete this form that you can access through some brochures. You can call any one of the partners you mentioned. How else can someone access this form?
There's two different ways. There is the website, starttheconversationvt.org, has all of the forms, as does the Vermont Ethics Network. They are the ones that actually publish the forms and take control of the entire process and the legal status. And another thing to mention, that the forms that we're distributing include this Vermont Directory Registry form. This is an important part of that step. Once you have your agent selected and you've got your information filled out, you should send this into the registry, and that puts it online so that you can, if you're not in the state of Vermont, somebody could look up your information and get this information. And you also get a card to put in your wallet and a sticker for your driver's license.
Oh, wonderful. So that tells somebody there is some place to look. I've already defined some individuals, and here's where to find it. So you would keep, so you've completed this form, you would keep your copy safely where you want to, but this is a online entry that you tell the registry you have that.
Yeah, and in addition, you should take you should give a copy of the form to your agent, to any of your doctors, any of the hospitals that you think you might go to, UVM, Northwestern. Am I missing somebody? Who else? Any other family members
Right.
you would like to
Your
have
person.
information?
Yeah,
course, the
absolutely a
agent,
person. Good. Okay, so do you need a lawyer to complete something like this? So you said it has to be witnessed, but not a legal
That's right.
lawyer.
Right. This is not a legal document.
Okay.
So it's different than what is it
will.
called? It's
living
not a
living
lot
will.
Of, it's a living will was sort of the predecessor of this, but often an attorney will have you complete this information if you go to them for a will, because another thing that some people want is a power of attorney for health care.
Okay, I'm glad you brought that up. This is not a power of attorney.
No,
This is just someone who says, I've talked to them, I know they would like it this way, but there can still be other people involved through the legal
Yeah,
aspect.
that's right.
Okay. So you've got it at the registry, but do bring it to all your healthcare providers, because you can't assume that they're just going to have quick access to it.
Right.
So that is the Who's Your Person, and you said over 18 because parents are taking care of the people and the decisions for under 18.
Right.
So, but yeah, I think that's important to mention too. We all think end of life, I'll plan that later. If you're a procrastinator like me, you might say, oh, I just did my taxes. It's the last minute. I don't need to do this till later. But talk about the importance of when to do it.
Well, a lot of people, society does not like to talk about death and dying, and we're all, a little saddened when we think of our mortality, and it's something that you really don't want to talk about. But there's a lot of education now about making your plan and finding your person, because again, illness has no age barrier, and if you're someone who wouldn't want specific things done, then you should have that written down.
Yeah, can you talk, so we're talking about what that plan is now. What are the kind of things that are included in that plan when you're talking with your agent? Here are things I would accept, here are things I don't want done. What do you mean when you're talking about those things?
So a lot of things are resuscitation. So CPR or cardiac resuscitation is a big one. Certainly most young people would definitely want to have that done. Older folks, though, with some chronic diseases may be thinking that they want to be home and not have that sort of care done. It's pretty invasive, and
It may cause other conditions, other things to happen in their situation.
That's
so it's
right.
an individual choice.
That's right. And it's something that is a living form too. So we talked about, what's your person, and that can be changed. The plan can change too. So I've started mine, and as my life changes or, I become ill, I will make changes to that form. It's about feeding tubes, breathing tubes, if you want to be on a ventilator, the resuscitation again,
Yeah, and,
those kind
and
of
you can
things.
talk with people to help you understand more of what the impact of those things would be. So it's not all on you to say, oh, I've heard about feeding tubes, or I've heard about this on a TV show. You should be talking to your doctor. And
That's right.
Yeah, and I guess the feeding tube and the being on a ventilator, those are two things that you can reverse those, but you can't reverse getting CPR. So you could say maybe if it's indicated, and I might be able to go on a feeding tube for a short period of time, yes, but CPR, it's a yes or no,
Sure. Yeah.
black or white.
Okay. Are there, when you talk about CPR, you brought up the DNR, which is do not resuscitate.
That's
And that means you don't want the CPR. Do you need another form specific? We hear about COLST and we hear about DNR forms. Are other forms necessary in that situation?
That's right. So COLST is cease of life-sustaining treatment, and it's a physician order. It's also a DNR. So that form, for folks who are more towards their end of life, should have one in their homes, because it is the only form that emergency medical services can follow. So let's say you have a very ill chronic person, or maybe somebody on hospice at home, and someone calls 911. Most often, they'll ask if there is any DNR signed for that patient. But that is the only form that can tell them not to start CPR if that's what they're.
That's the guidance that they need to have.
That's correct.
So I can't just get DNR tattooed on my
No, the
chest?
tattoo doesn't
might
work.
not be
Oh, okay.
It doesn't work.
And well, that brings up another point. That you're assuming things happen at home all the time, but they don't always happen at home. So if you're out and about, these things are saved on registries, or make sure they're at the hospital or with a doctor.
That's correct.
And they know how to access, the emergency personnel know how to
Yes.
access that. And so you keep talking about being a living agent. So you filed these forms, your person form, your plan. Then you decide 10 years later you want to look at it again. How do you know for sure that everybody gets the updated one? That's just on you to send an update to the registry and to talk to everybody again.
That's
Yeah,
right.
Yeah.
Yeah, you just follow up with everyone that you did before, and then everyone has your information.
Yeah.
Yeah. And another thing to point out, there is a very short form which is called the healthcare agent form, but as we get a little older or lives change and things like that, we might want to think about putting more of the detail down. And there are two different versions. I only brought what's called the short form, which is 8 pages long or something. It goes into more detail, gives you opportunity to even do things like plan your funeral, quite frankly. And it asks a lot about the feeding tubes and all of that, spiritual wishes. So.
Yeah, I think that's, like we said before, we plan for so many things. Just, and why not when you have the opportunity? If you have favorite songs you want to play or things like that, this is a place you can literally put down some specific ideas about even after you're gone. And you're in hospice, you're comfortable talking about this with people, or I'm sure sometimes it's still uncomfortable, and this is what you do. So right now we are having a hospice volunteer training at Franklin County Home Health, where individuals in the community learn about all these other aspects too, the spiritual aspect of hospice. Talk a little bit about that training, if you would, for just a minute, about what people learn about end of life when they go through a home care hospice training.
The hospice training literally describes and teaches volunteers everything about how to be in a hospice home, how to support the patient and the family if needed. They're given education on, comfort measures. If a patient's having pain, what should you do? Or if a patient is uncomfortable, maybe needing a little reposition of the pillow or something. That's all taught in that class. A lot about spirituality, supporting families, through their grief, in their vigil.
So they really understand the home they're going into, the situation, of what it's like at the end of life,
That's right.
everything they might encounter.
Right.
They're not responsible for handling all those things, but to get a good understanding of what they're doing and who they're there to help.
Exactly.
So
Who to call.
it's a beautiful program in that you are there for people at this time that is so needed to have the medical staff there, volunteers to give respite. So understanding hospice, I'm sure, is a big part of your role in this campaign, is saying, this is not an order for hospice, certainly something completely different, but this is a good place where you might say, I'm interested in hospice at that, if I get a life-threatening illness, this may be a place where that hospice would be one of your options.
Right. We never, those who don't think about planning because they just can't come to grips with it, a lot of it sometimes waits until somebody comes on to hospice, and then it's a lot of stress. So we, by providing this education in the community, we're hoping that more folks will consider, planning their life plan before something like that happens.
And I know from my experience, 6 years ago, I thought hospice was something you only went on if you had cancer. And had an experience with my own mother, and the nursing home where she was, the doctors wanted to put a feeding tube in. And we said, is there another option? And they suggested hospice. And it made the last 6 months of her life so much more comfortable. She could live with dignity. It wasn't that she couldn't eat. She just couldn't see half her plate, so she wasn't eating. So the hospice volunteer would go in and turn her plate and do some things like that just to encourage her, take her down to the musical things. So it was just a wonderful experience,
Yeah.
and it proved to me that just hospice is something you get even just for being old.
That is true.
Just for being, the gifts of giving. So you think you've shared a lot about advanced directives, naming your person, the importance of it. It's great how you're doing this through April, sort of a community campaign, trying to get the word out. So we hope that people, Mary, if you talk about the Who's Your Person plan.
Oh, okay. One of the things we're doing with the partners is we're doing what's called, it's kind of like this is a whiteboard, but you could just do it on a piece of paper. And we're encouraging people to do one for yourself, email it to info@fchhh.org, and share it with us. And what it is just saying, who's your person? I'm going to write my person down. Send a selfie of yourself with your whiteboard.
That's right.
And don't forget the hashtag Who's Your Person 802. We're trying to make this go viral.
Yeah, social media. Good.
Yes.
So as easy as that, but then going forward and doing your form.
Yeah.
Mary, could I ask you to tell our viewers, because April also brings allergies and I'm having a little trouble with
Okay.
my voice right now. You know about some exciting things coming up in our community for
Yes.
events. Can you talk
Right.
about those?
Related to this is we have in May 18th, we have a childhood bereavement seminar. We have a little flyer here. And that's a program run through our hospice department as well. And it's a specific training for people on how to deal with children and grief. It's not necessarily that they're on hospice, it's that they live in the home of someone who is on hospice. It could be a parent, a grandparent, aunt, uncle, someone like that. Children experience grief very differently than adults. So it's a really wonderful seminar. It's a day-long seminar, May 18th at Church of the Rock from 8 to 4. A minimal registration fee of $20 to cover the cost of the breakfast and lunch that's included. And we've got speakers that include our own hospice staff, as well as here's authors and educators, a musical therapist, a dance movement specialist, and just all to talk about how to deal with the grief.
So it's May 18th.
May
They can
18th.
call our office, and we thank the United Ways of Northwest Vermont for also being a sponsor of
Right,
that.
yes.
But yeah, open to providers or families or anybody interested in children experiencing the loss of a loved one here in our community. Very good. And then we have a fundraiser coming up.
Yes.
Quickly talk
yes.
about that.
May 6th, we're doing a fundraiser jointly with the Enosburg Opera House, and this is to help support the work we do providing home care and hospice in the community. And it's May 6th on Saturday, Rusty DeWeese as the logger with fiddler Patrick Ross. And we're calling it Laughter is the Best Medicine. So that's doors open at 6, and Rusty will be there in his to greet you.
Yeah.
If you come early, you can get a selfie with Rusty.
You promise? So that's, how much are the tickets for that?
$25.
$25 at the Enosburg Opera House website.
Yes, yeah, the tickets are for sale through the Enosburg Opera House.
Okay. So we are running out of time today, but I want to thank you both for coming and talking about advanced care planning. And if our viewers have any questions about advanced care planning, they can call Franklin County Home Health Agency or one of the partners in this initiative. You can find more information online at www.fchha.org or call us at 527-7531. And again, we thank you for watching and be well.